Welcome back to Air Quality Matters and One Take. One Take, my take on a paper or report on air quality, ventilation and the built environment. One Take, in that it's, in one take and tries to summarise for you a scientific perspective on something interesting in, usually 10 minutes or less, because who has the time to read all these amazing documents, right? This week, we're looking at a very practical and honestly quite telling piece of government guidance. It was published very recently on the 24th of February 2026 by the UK Department of Education. The document is titled Ventilation and Air Quality in Education and Childcare Settings, and it applies specifically to England. Now, I wanted to cover this document because it represents a really fascinating shift. For years, we've been arguing about the science of airborne transmission and the need for better air in schools. What this 2026 guidance shows is that the argument is largely over. The science has been accepted and codified into standard operational guidance for educators. It plainly states right at the beginning that good ventilation is absolutely essential for healthy and productive learning environments. It acknowledges that effective ventilation does more than just prevent a room from overheating. They explicitly note that improving ventilation improves pupils' alertness and concentration. It removes polluted air, and crucially, it removes air that might contain virus particles, which reduces the spread of respiratory infections like cold and flu and COVID-19, to take the recent pandemic as an example. This is massive. It places the management of indoor air quality squarely in the realm of basic school health and safety. But how do they expect schools to actually manage this? Well, the guidance leans incredibly heavily into monitoring. It explains to schools that they need to regularly monitor CO2 concentrations across their buildings because humans exhale CO2 when they breathe. Tracking it indicates the proportion of fresh air in a space. It helps facilities teams and teachers identify spaces that are poorly ventilated, which are often the rooms that feel stuffy and have unpleasant odours. And the Department for Education doesn't just say, buy a monitor. They provide best practices on where to put them so that they get an accurate representation of the room. You shouldn't put them right next to doors and windows or ventilation outlets. You need to place them at a head height or at a table height for seated occupants. And to prevent the sensor from just reading the direct breath of a student, they need to be at least half a metre away from people. They also introduce a very clear, easy to understand system for CO2 readings. Measured in parts per million or ppm, if the level is under 800 ppm, your ventilation is considered good. If you hit that mark in the middle of winter, the guidance suggests you can actually partially or completely close the windows to keep the classroom warm or conserve energy, while just keeping track of the readings. If the reading sits between 800 and 1500 parts per million, the ventilation is deemed adequate. But you should consider opening doors or windows to improve it. But if that monitor creeps over 1500 parts per million, your ventilation is officially poor, and you need to actively increase ventilation where you can. What I really appreciate here is the pragmatism. We all know what schools are like in the middle of winter. The guidance addresses the real-world conflict between keeping kids warm and keeping their air clean. They suggest practical compromises like partially opening windows just to let a bit of fresh air in, or opening the higher level windows to reduce cold drafts hitting the kids. They also recommend airing rooms out by opening everything up for 10 minutes every hour during lesson breaks, or do a full flush of the air. And they throw in a very necessary health and safety warning. Do not prop or wedge fire doors open to get cross ventilation or breezes through the classroom. Interestingly, the document goes beyond just CO2. It talks about using multifunctional environmental sensors that can track a whole suite of issues. These sensors can measure temperature, humidity, and particulate matter like PM2.5 or PM10, which covers things like pollen, dust, and soot and traffic pollution. They also mention monitoring volatile organic compounds or VOCs, And the examples they give for VOC sources are incredibly grounded in reality from modern schools. Formaldehyde, cleaning chemicals, body odours and vaping products. Yes, they specifically mention monitoring for vapes, which is a huge issue in secondary schools right now. Now, let's talk about the hardware solutions when opening a window just isn't enough. The guidance addresses the use of air cleaning units or ACUs. They acknowledge the use of ACUs are useful when you just cannot maintain an adequate supply of fresh air, or you're in an area of external air quality concerns like schools situated in an area of high traffic pollution. But, and this is a massive but, and it's something that we do talk about on this podcast from time to time, the Department of Education is crystal clear on the limitations of air cleaners. They state explicitly that while ACUs reduce airborne contaminants, including pathogens like viruses, bacteria, and fungal spores, and so on, they do absolutely nothing to improve ventilation or lower CO2 levels. They are not a substitute for ventilation. You cannot use an air cleaner as a reason to stop opening a window or using mechanical ventilation. And plugging in an air cleaner shouldn't delay any actual remedial building work you need to do to fix poorly ventilated spaces. When it comes to the technology inside these air cleaners, the government takes a very firm evidence-based stance. The Department for Education states that they only recommend HEPA, which might be interesting to some here. That is high-efficiency particulate air filtration units. That is a subtractive technology. It simply catches the bad stuff in the physical filter. They explicitly state that they do not recommend other devices. They specifically name and reject air ionizers, ozone generators, and units that use unenclosed UV fields. The government is effectively telling schools to stick to proven filtration technology. But here is where we get to the sting in the tail, the reality check. The guidance notes that between 2021 and 2023, the Department for Education ran a massive program where they provided CO2 monitors to all state-funded education and care settings. And they provided air cleaning units to settings to help improve air quality in poorly ventilated spaces. It was a phenomenal public health rollout during the pandemic. However, we are now in 2026. The guidance reminds schools that these air cleaning units require regular maintenance and the filters typically need to be replaced every 6 to 12 months. And then comes the hammer blow. The Department for Education explicitly states that they will not replace faulty or damaged devices that were provided during the initial ventilation program, and they will not pay for replacement filters. Now, I know a lot of schools ended up with technology that may have not been fit for purpose at the time, and certainly many of the air quality monitors that were deployed weren't connected, certainly weren't measuring pollutants beyond CO2, and their ability to record data was fairly limited. Think about what that actually means on the ground. We've established that clean air is vital for learning and health. We gave schools the equipment to clean air a few years ago, but now the ongoing financial burden of maintaining that clean air has been shifted entirely onto the shoulders of the individual school budgets. And before we wrap up, I do have to acknowledge a few things in this guidance that are going to make some of the folks in our community squirm a little bit. First, right off the top of the document, it talks about bringing in fresh outdoor air. We all know that phrase is doing a lot of heavy lifting. Many are going to squirm seeing outdoor air described as fresh by default. Outdoor air isn't always fresh, especially if your school is backed right up against a busy road or an industrial zone. Second, the guidance explicitly names NDIR or non-dispersive infrared sensors as the most effective type of CO2 monitor. And look, NDIR is great, solid benchmark and all that. But from a technology standpoint, it's probably already a bit behind the times. We're seeing incredible advancement with things like photoacoustic sensors, for example, which are smaller and incredibly accurate. But standardizing on NDIR is at least a safe baseline for schools to work from. And finally, we have to talk about that 1,500 parts per million CO2 threshold. The guidance says under 800 is good, up to 1,500 is adequate, and over 1500 is where your ventilation is officially poor. There are many in our community who will fairly argue that allowing CO2 levels to get anywhere close to 1500 parts per million is simply not an acceptable risk. If you are dealing with vulnerable populations, at-risk groups, or kids who go home to vulnerable family members, 1500 parts per million is just too high a ceiling for shared, occupied spaces where respiratory viruses can spread. They will absolutely have a strong opinion here. So, what is the ultimate takeaway here? From a building science and public health perspective, this document is a massive victory. It proves that the foundational arguments about indoor air quality have been won. But from a policy and operational standpoint, it highlights a looming crisis around who pays for it. We've won the argument on the science. Now the battle for funding that clean air and tightening these standards to truly protect the vulnerable is just the beginning. Thanks as always for listening to this week's One Take. These podcasts are not possible without our sponsors, Safe Traces and Imbiot, so thanks a million to them. And if you get a chance and you enjoy these podcasts, do give them 5 stars, I think it is. Apparently that makes a huge difference for who gets to see them, and leave a comment and share. Always appreciated. Thanks a million. We'll see you again next week.